A recent report by the United Nations Office on Drugs and Crimes, UNODC, says counterfeit drugs kill around 500,000 persons in sub-Saharan Africa each year, and a huge chunk of that number is in Nigeria. The National Agency for Food and Drug Administration and Control, NAFDAC, puts the prevalence of counterfeit drugs in Nigeria at 15%, but other expert bodies like the Pharmaceutical Society of Nigeria says the figure is at the very least 40%. Regardless of what the actual figure is, one thing is certain: Nigeria has a serious counterfeit drugs challenge that needs to be dealt with to save lives. And that is where this young man comes in with his healthcare startup, Remedial Health.
At Remedial Health, we say we are digitizing the pharmaceutical supply chain in Africa. And we do that in a number of ways. So, for example, we provide software to pharmacies and hospitals for their operations. We help them with their supplies, so they can place orders for items that they need and get it to their stores without lifting a finger, well, apart from placing an order on the phone.
By digitizing the pharmaceutical supply chain, Remedial Health serves as the link between drug manufacturers and consumers, ensuring that those signed up with the startup access authentic drugs and avoid counterfeits.
In Nigeria, the figure for counterfeit medicines sold is 40%. So 40% of medicines you buy are likely counterfeit. Last year, 2022, we sold over 100 million individual packs of medicines around Nigeria. If we are to use that in relation to the percentage of counterfeit medicines in the market, we can sort of estimate that we've replaced somewhere around 40 million possible counterfeit medicines in the market.
Many neighborhood pharmacies and proprietary patent medicine vendors across the country have signed up to Remedial Health, making it possible for them to stock authentic medicines directly from manufacturers. Rachel Benjamin, who runs her own pharmacy, says beyond providing her with original drugs, the startup has made life easier for her.
We go to Lagos market to buy drugs before, but this time around, Remedial brings the drugs to you. They deliver to you. You don't have to stress to go to the market, select the drugs. You just go online and make your order. They deliver it.
In just 2 years, Remedial Health now covers almost all of Nigeria using technology to distribute original drugs to hundreds of hospitals and pharmaceutical stores.
In the next 10 years, Remedial Health will be we like to say, the operating system for pharmacies and hospitals in Africa, right? What that means is we are not only your supply chain provider. We are also maybe your technology provider. We are your payments provider. So if you need to open a pharmacy tomorrow, talk to Remedial Health and you are pretty much sorted on everything that you need to get your business running.
With more than 260,000 pharmacies and proprietary patent medicine vendors in Nigeria and more than 1.5 million across Africa, Remedial Health is hoping to leverage technology to be a leader in the pharmaceutical distribution chain and help fight the scourge of fake drugs on the continent.
So, I just saw a video there where they are saying over 500,000 people died in Nigeria from counterfeit drugs. But this is not an African issue or a Nigerian issue, because counterfeit drugs is a global situation, because ever since the pandemic, it exploded when people buying counterfeit drugs online. And keep this in mind when they're talking about the UN is giving this report. Africa have very few pharmaceutical refineries on the continent. Most of these drugs is produced outside of Africa, Europe, America, and such as other countries like that, right? So everything they say that they are reporting on about counterfeit drugs are shipped into Africa. It's not made in Africa. So even in the States alone, just in America alone, over 100,000 people die annually from drugs. So they can make it seem as if it's only in Nigeria or in Africa we're having this issue. It's a global issue. And who do you think are producing these counterfeit drugs? It's the same pharmaceutical companies that are producing the real stuff, because they're the ones who have the factories and the know-how on what to do. And this is a money-making thing, and I've always said before, they tend to use Africa as a dumping ground. There's a report also when over 15 million tons of used clothes is dumped in Africa every month. Like every month. No, every week, my bad. Every week, 15 million tons of used clothes is sent to Africa as a dumping ground. And so this is the same thing with the medication. This is accessible online. It's not, you can go and look it up yourself to see where everything is just boom and thrown in Africa and dumped there, including these pharmaceutical. And that's why I don't trust the Red Cross and all those other companies, because they actually do drug testing in Africa, especially in rural areas. And this is documented information. This is not nothing new, I'm saying. Just that the major networks doesn't show this because they are being paid off by these multi-billion-dollar pharmaceutical companies. So with this gentleman, young man, trying to structurize medicine on the continent, it's a good look. But I hope in the future he don't get infiltrated by the West or Europe to cause harm to Africa and the continent. So I hope he's will become very independent and governments back him up and don't leave no farmer external country so-called how do you call them now? These so-called experts to come in and aid in this. I hope he build it on his own with the help of African countries, not Western countries. So it's a good look for him to revolutionize and organize and make everything become more transparent. Then people have to go on the backdoor deal. And people do this because some of the time as well, people can't afford some of these medications. So what they have to do, they have to buy it off the black market, or they buy, when they get it cheaper elsewhere, they will pay for it because some of these people are highly in need and they cannot afford it. Financially, it's not sustainable for them to go and purchase it by a pharmacy, and sometimes they have to go to a bunch of different red lines. Like for instance, they have to get the doctor prescription and stuff like that, and it's difficult to get if you don't have access to the doctor in the first place because of finances. So this is how this thing, but it's a global issue because again, since COVID, this thing exploded between 50% to 95% in the West. I'm talking about the explosion of counterfeit meds that's been circulating online. So this is not done through no backdoor deals or through no corner side. This is done online. Online purchases of counterfeit prescription has exploded. So I don't want this UN come to single out Africa and singling out Nigeria as they are the only ones, or they are the most consumed. No, they're not the most. The West consume the most counterfeit drugs out of any other nation put together. So this report by the UN it's a kind of a red herring to make it seem like it's a big issue, on the continent, but it's not as great an issue as how they're making it out to be, because it's more on a greater level in the West and in Europe as well, because again, this is all a finance things. These pharmaceutical companies design these same counterfeit drugs and push them out to increase their profit. They don't really care about people. So, especially when African countries tend to resist and refuse modern medicine, because even during COVID, a lot of African countries had refused the vaccine, and especially the president of Tanzania, he was hell-bent on keeping it out of the country and out of the continent, and he eventually died because they so-called corona killed him, but he was assassinated because of the pushback he gave and the way he exposed the vaccine and why he refused it. So yeah, so keep an eye out for when you're ordering stuff online, especially meds. Make sure you can go and Google how the pill, whatever you order, how it looks and how it should looks, and then you can hopefully compare them and make sure you're not ordering any counterfeit drugs, because it can be harmful because it's not as regulated as the good stuff. So anyway, thanks for watching. I don't know, it's the WXXM podcast. So don't know, like, share, and subscribe. Tell a friend, tell a friend. Peace, one love. Boom.